GP120 for attachment, and GP141 where it interacts with the virus attachment before it gains entry. So the transfer of both fluids, e.g. blood or semen, or also transplacental and perinatal transmission has been reported. So you can get it through sexual intercourse, through blood transfusion. You can also easily get it for unborn babies through transplacental infection. Once this infection is there are normally two receptors are required for the HIV to enter the cells and then establish the disease. One receptor is the CD4. When you commonly hear about the CD4 count, it is because this receptor is found primarily on what you call the T or on the helper T cells. So if you are doing analysis and you find this CD4 cell count is low, it tells you the helper T cells have been, much of them have been affected, and therefore your immune system is getting compromised. So this HIV affects and kills helper T cells, which this predisposes the person infected with opportunistic infections. Other cells bearing the CD4 protein on the surface, e.g., the astrocytes, are also infected. So I was saying that other cells like astrocytes are infected also. And then the other receptor for HIV is chemokine receptor such as CCR5. This receptor CD4 and the chemokine receptor CCR5, and we also have another one CXC are are what? There's another one. There are normally three, but here the major one that determines the prevalence or the spread of the HIV virus in the body is the CD4. That is where we normally focus most. Now, when you are doing the diagnosis in the lab, you can do a serology, you can do ELISA, you can do PCR. There are so many tests you can use to check for HIV. Treatment. There are normally a number of drugs used to treat what we call antiretroviral drugs. We have the thymidine, what we call AZT. We have 3TC, uh, the way that listed here. This is a panel of drugs that are normally used, and they are normally used periodic and interchangeably according to certain periods, circumstance, depending on after they are doing the monitoring of the drug in the body. So highly active retroviral therapy (HART) consists of two nucleoside inhibitors and one protease inhibitor. Non-nucleoside inhibitors such as the nevirapine are also useful depending on the recommendation of the doctor after the severity of the infection, how it comes. So clinical improvement occurs, but the virus persists. Treatment of the missing infection depends on the organism. How do we prevent? Screen blood before transfusion. Avoid having so many partners, sexual partners. Where necessary, use the the condoms to prevent or to prevent this infection, or have what you call safe sex.